Good morning, ladies and gentlemen. My name is Ramanyang. I'll be your MC for the day. Would like to, of course, invite you to this dialogue about African healthcare supply chains. We'll be focusing specifically on East Africa for some of the conversations that we're having today, but that by no means is a definitive boundary for the imagination that we're going to be bringing to the table today. Let's start with an introduction of our co-conveners and the main reason why we're here today.
By 2020, East Africa alone was spending about $1 billion annually on healthcare. So is there a gap? Is there no opportunity? There is.
It's also millions and millions of naira, CD, shilling, rand, which have been collected from families to send people off the continent to go and seek treatment in Dubai and India and the UK. And if all of those monies were sunk into our health facilities, our health systems, we will be very far.
The suppliers, the manufacturers, the surveillance people who are doing surveillance on disease, all these people have insights, but there is no channel through which all these people, all these actors can communicate actionable insights in real time to make sure essential healthcare products are where and when they are needed. And in simple terms, what Xetova is doing is to build technology and deploy resources to enable essential healthcare medicine to be where and when it is needed.
That certainly does set the stage for what we'll be discussing today. I'd like now to introduce Safaricom's Chief Enterprise Business Officer, Chris Sananu. Please come up to the stage for his opening remarks.
In the last 5 years, we've decided to focus on 3 core industries: health, education, and agriculture. Nobody would have thought that technology and health would be bedfellows. And so healthcare ecosystems and quality healthcare cannot be provided without technology. For us as a company, our aim is that we can help through our partnership through Xetova to use artificial intelligence, big data, and the power of our infrastructure to be able to give timely quality information to health providers such that we can be part of the national agenda of ensuring that healthcare gets to the people on the ground.
Why is healthcare important? Healthcare is unique in the sense that decisions in healthcare equals to life and death in some cases. COVID reminded us that, you can have all the power, all the knowledge, all the money, all the medicine, but if you don't have the mechanism to respond to certain needs on time, if you don't have a framework to get people or actors to work together seamlessly, then there's a challenge. So we built Xetova at a time when these realities were happening. We built technology to provide forecasting for supply chain, in the sense that we'll be able to use machine intelligence to tell you, anticipate, that you will need 10 cartons of malaria in Kisumu at this point. Just simplistic ways of using supply chain technology. And why we are here is we realize that technology alone does not transform. Technology alone doesn't have the power to actually make people or change things or create change. It is transformed people with the right tools who bring transformation.
The collaboration between Xetova and Safaricom marks a new beginning for public-private partnership. The significance of these initiatives is to enhance visibility and capacities of the Ministry of Health and its agencies in real-time planning, tracking, and reporting on the utilization of resources in the health sector. It is now my singular pleasure to declare this dialogue officially open. Thank you.
We're moving into our first session, the Ministerial Round Table. It's going to be an interesting conversation from a policymaker's perspective on what you should expect in trying to build out better healthcare systems across Africa. Dr. Bazibamo, the floor is yours.
Thank you, moderator. Good morning, everyone. Honorable ministers, dear participants or protocol observed, as you may know, our community East Africa is on an integration process for 6 partner states. Honorable Ministers, we wish really to ensure that import of medical products should only be for products we cannot produce ourselves. Our pharmaceutical manufacturers are crying that we are not supporting them enough, and for capacity is there. Most of them are producing less than actually 50% of their capacity because of lack of a market. This platform is very important. It's an important tool which will help us actually to keep on exchanging experience, help us to keep on exchanging and talking about best practices, and trying to see what we can upscale in our region. But what is needed is a commitment.
I think the pandemic has been the largest wake-up call as far as the Africa supply dialogue is concerned. For many, many years, we've been so reliant on importing everything into Africa to an extent that even the smallest items used in healthcare, we were finding it easy to import them and use them. When the supply chain started shutting down, it dawned on us that we might be locked out of the entire health system.
I wouldn't call it a rude awakening, but I think that jolt was necessary for us. That jolt that it provided, more than a jolt actually, an electrical shock maybe, was needed for us to get out of our position of complacency and to begin looking at issues very deeply and critically. We need to look at it from our lenses on where we can apply it. You know, we can talk about the health, the supply chain, getting products out there, but if we don't have a strong health system, then we will still face problems.
But many of these challenges, Dr. Thakur, need sovereign states to implement within the context of this grand strategy. So one of the key decisions that have to come from such events is, are we going to champion East African healthcare? And are we going to, see to it that we build the necessary ecosystem?
Thank you. Thank you very much for that particular discussion. Second session will focus on shaping and leading healthcare supply chains. Essentially, COVID-19, as you're all aware in more ways than one, really exposed a whole host of weaknesses that come through with how we've been managing our healthcare systems for a fairly long period of time. Professor Xetova, over to you.
So what we want to do in this session is, how do we take some of those points into more operational things? What can we do? Where do we make a start? How do we translate some of this higher level agenda into things that companies, organizations, firms, nonprofits, government operational agencies can start acting on? We have to be very clear that the vulnerabilities in the healthcare supply chain, which COVID-19 exposed and made clear, are things that happen everywhere in the world.
As we all know, demand for medical equipment during COVID spiked up by thousands of percentage around the world, entirely and found us entirely unprepared and without any unprecedents for this. So scalability of the production, something we have thought about very little before in the pre-COVID era, become critical. And the ability to create production capacity in a very short period of time is something that must be calculated in the way we structure global supply chains in the future. Healthcare is an industry unlike any others, is it not? And we need to rethink how we approach inventory and the balance between inventory and reliance on global supply chain for the immediate supply of our needs.
It's time for us as Africa to use this inflection point to actually become an alternative supply chain to the world. We've got an educated population. And now if we're combining that with the skills coming from Xetova, with digitization, going to a 4IR, we can create that industrialization that we need. What we've seen now in terms of the solutions coming out of Xetova, because of that belief from our own people, is phenomenal. And we need more of that. We need to facilitate and capacitate more Bramwells. We've got the capacity on the continent to do it, and to do it efficiently and to scale very quickly. but it has to be internally driven.
Then we have matters of governance that have really posed a great challenge in the management of the healthcare supply chain system. And in governance here, we're looking at areas of, as had been mentioned earlier, inadequate planning, whereby we failed to plan adequately, lack of contingency planning. This was a great challenge, especially when it came to COVID-19, the COVID-19 pandemic.
An interesting observation I have made is that COVID-19 had brought a new area. The subject of supply chain had been interesting. I would like to ask my participants here, I believe strongly that before the onset of COVID-19, there may be some people who have not heard of this subject, supply chain management. True or false? Another point we have to consider also is that it is not only having the capacity, but even we don't have the raw materials here.
But I think it's really for the health sector, recognizing all these challenges, that it needs to open up and open up to the private sector, particularly those who are in the FMCG sector, to see, to set up a forum where they can actually share knowledge around how you get goods from A to B.
When export restrictions kicked in, many countries started to repurpose their facilities to be able to manufacture locally some of those products that we needed. And because of that, a whole new area, and looking at Africa, a whole new area of health commodities manufacturing locally sprang up, including what we are talking about, the vaccines. We want to ensure that the motivation for investing in supply chain, whether it is R&D or actual manufacturing or transportation from one part of Africa to another. When we look at that whole preparedness, we need to ensure that we have systems in place. We also need to have structures in place. When we are manufacturing, what quality are we manufacturing? How do we pool our resources together?
We cannot talk of the continent that we talk of Agenda 2063. No, leaving no one behind when you import. And we know that when we import, when we have a pandemic like this, you cannot supply your own needs. And if it's a country content that cannot make sure that its people are not healthy, what productivity are we talking about? What economic and social development are we talking about if we cannot ensure that our people are safe, our people are healthy, our people are able to go to work? So that's the fundamentals that were wrong, and the COVID just exposed what was already existing.
But once you get each of these countries now collaborating, once you have the data, which is what Xetova provides, then now you're able to have the effective supply chains, like what you find in the private sector, like what you find with an Amazon.
So talking of the supply chain, it's the same thing. The supply chain management is still looking on the supply side, as it says, but on the demand side, where people, when they're well informed, they well know, they're able to question the government in terms of accountability. They're able to question the community governance structures so that we can account on the resources that have been allocated, but also they'll be able to understand and get away from the myths and the misconceptions because they've been informed. So health literacy and the information sharing needs to be further emphasized, and actually that has been a gap.
Technology is about the clarity of the problem you're solving, because the absence of the problem you're solving or the purpose of why you're using that technology, then that's where the gap is. I can predict how much you're going to make 5 years from now based on your last 10 years. Okay, that's cool. You're telling me I'm going to be a millionaire, but then what? You see, how I use that information is what makes that technology useful or useless. It is what we do with that technology or the problems we intend to solve with that particular technology.
For example, in the case of health, records are kept properly. The patient can get medication fast. The doctors have access to information. Telemedicine is enhanced and enabled. And we can all live enhanced, healthy lives through technology and such partnerships. African governments can spend whatever they want to on hardware and software. If we don't change the programming language, the attitude, the focus of the people who are behind these computers, we're not going to get much from it.
Okay, so one last push. I'd like to invite our next set of speakers up for our next panel discussion, focusing on opportunities, gaps, and challenges.
In the COVID era, which is in the last 2 years, the biggest breakthrough that we have seen is what I term home-based care. If we can Uber in and utilizing a digital platform for technology, then I think those are great innovations that we have seen. As a patient, instead of taking an Uber to go to Kenyatta or to go to a facility, whatever it is, I would Uber a nurse to come and give me my injection at home. Your blood pressure can be provided by great services by our community health workers, especially in our public sector. Your phone actually is your next platform for your pharmacy services. I think the other innovation that we have seen in the last 2 years has been platforms that are coming in as distribution platforms that are online. You can order and have full visibility of prices and medicines. And for me, that is actually where have been long before even today. But that disruption and speaking to supply chain is there to stay. There is need for concerted efforts by the African governments to align and agree where do we set up the centers of excellence. So as we fight for local production, we need to think about also empowering the consumers. That's why for me the supply chain conversation starts and ends with the patient in mind.
So who needs to invest in that? That is a question. Is that part of the enabling environment, or is that a prerequisite for players to come into the space? And I think those subsidies really need to be looked at. That's something we've been subsidizing. We view it as part of making this system more resilient in terms of diversity, equity, and inclusion. So the insurance markets really need to open up. We need to have much more kinds of micro insurance schemes around specific health facilities, and we need to build this out. And we see it is already happening in Makwene and Kitui County, for example.
That word collaboration, I think we can all agree, is really what we need to see. Private and public sector need to come together, and we truly do. We do on certain platforms, but we truly need to engage and understand each other, especially because, you know, it's what is needed, that private-public partnership. With regards to insurance, it's great to see how devolution works. And maybe we'll see more of this when you look at Ukambani and you see what's happened in 2 of these counties. This is great. This is great strides. Can it be sustainable? Can it be replicated? Is there going to be different models, as Mark alluded to, in terms of micro-insurance? You know, how do we look at this? You know, as we said, put the consumer at the heart of all of this. How can they access healthcare? What insurance models are being put in place?
We have now come to the end of what has been a really invigorating, challenging, and transformational day. To our co-conveners, Safaricom, CCA, ARC, and our hosts for today, Strathmore, truly, truly grateful. We would not have made this a success without you. As Bramwell mentioned, this is the first of several, so we will be taking this show on the road, and look out for the dates for our next supply chain conversation. Thank you very much, and do have yourselves a wonderful evening.